Thanks, Sam. We have always known that 50 is the age when most people should get their first colonoscopy, but now that recommendation has been moved to 45. Joining us to talk about this is Dr. Parikh, Dr. Neil Parikh, a gastroenterologist with Hartford Hospital. Doctor, welcome.
Thank you, Lisa, for having me on today.
Oh, thanks for being here. So the U.S. Preventive Services Task Force just recommended lowering the age of colon cancer screenings to 45 years old. Why is that?
So over the past few years, we've seen some staggering data regarding colon cancer in younger adults. According to the American Cancer Society, a millennial today has twice the risk of colon cancer than someone born in the 1950s. That risk quadruples when you look at rectal cancer alone. Put it another way, someone in their 30s to 40s has a 4 times as higher risk of colon cancer than someone in their 50s and 60s. Unfortunately, all of us in our profession have multiple examples of colon cancer in younger adults, and the untimely death of actor Chadwick Boseman further highlighted this alarming trend and further reinforced the absolute need for earlier colon cancer screening.
Doctor, that's astounding. Do we know why? Is it diet, lack of fiber?
It's probably all of the above.
All right, what are the benefits of earlier screening?
Earlier screening means we detect the cancer faster. And in the case of colon cancer, when we find it faster in its early stages, we have a 90% 5-year survival rate. We have a great array of endoscopic and surgical tools to beat this cancer when we find it early. This is one of the main reasons we have over 1 million colon cancer survivors in the United States today.
What types of symptoms should people watch out for in terms of colon cancer?
So common symptoms include a change in bowel habits, rectal bleeding, abdominal pain, and fatigue. Of course, these symptoms are very nonspecific, and many of us have experienced them in our lifetime. However, if you have these symptoms and they persist, it is critical to speak with your medical provider. Unfortunately, for many of our patients with colon cancer, they have no symptoms whatsoever. This is why screening is so important. Screening allows us to detect cancer in those patients who have no symptoms at all.
All right, let's talk about detection. Colonoscopy, are there other screening tests available? What do you recommend?
You're right, Lisa. There are a handful of effective screening modalities. And I tell my patients, the best screening test is the one that you will actually do. Options include stool tests, radiographic tests, and a colonoscopy, which is where we can detect colon cancer, but also find and remove the precursor to colon cancer, known as colon polyps. It is this ability of a colonoscopy to be both a preventive test and a screening test that makes it the gold standard and separates it from its stool-based counterparts. However, I tell everybody, and I cannot stress this enough, any approved screening test is better than no screening test. So speak with your provider and go get screened.
All right, before we say goodbye, hartfordhealthcare.org/digestive is the website if people want to know more, and we'll have that on WTNH.com. Dr. Neil Parikh, thank you so much for being with us. We appreciate it.
Thank you very much, Lisa.
Right.
Have a good day.
Thank you. You too.